Oh, it's
Yes.
on slideshow now. Yeah.
Okay. So, ladies and gentlemen, good afternoon to all of you. Here, I have the pleasure to share with you all on the traditional and complementary medicines and elderly health in Malaysia. Prior to my presentations, I would like to tender a word of thanks to Professor Angela as well as her team for their kind invitations. Okay. So this is the outline of my presentation. First, I will touch on the overview of elderly health and care in Malaysia, then followed by the important as well as low roles of T&CM in elderly care. Then the governance of T&CM in Malaysia, T&CM services for elderly in Malaysia, as well as end with the challenges and way forward. Ladies and gentlemen, T&CM means traditional and complementary medicines. Okay, so the Department of Statistics of Malaysia, okay, has reported the populations of elders in Malaysia has grown significant in recent years, with the age of 60 years and above, so account about 11.1% of the total populations of 32.9 million, means it's about 3.6 million of them are aged 60 and above in Malaysia currently. This number is expected to rise continuously in the coming year. Malaysia is expected to be an aged nation by 2030, with the populations of 16% of them will be age 60 and above. So this is the statistic that has been shared with us from the Department of Statistics Malaysia. So the demographic shift has implications for healthcare, social welfare, and economy for policy. The elderly populations in Malaysia is also diverse, with different ethnic, culturally, linguistic background that affect their health behavior and needs. I think behavior is very important, okay, so that in order to have someone move into healthy aging era. So the National Health Mobility Survey 2018 reported that functional limitations, depressions, are the more prevalent among Malaysians older people. The survey also showed high prevalence of diabetes, hypertension, as well as hypercholesterolemia among Malaysia pre-aging and aging populations. Health challenges are often compounded by the socio-economic factor such as poverty, limited access to healthcare services, and social isolations. So, ladies and gentlemen, Ministry of Health Malaysia, in order to address the aged care, in order to help the elderly group to move into healthy aging, a lot of initiative has been implemented. First and foremost, a national health policy for older persons 2008 has been developed. The main objective is to ensure that older persons in Malaysia can live with dignity, security, and respect. It includes strategies such as improving health and healthcare services, promoting social engagement, and enhancing financial security for older persons. Subsequently, the Family Health Development Divisions under the Ministry of Health had taken the initiative to implement many programs such as elderly healthcare services to provide the comprehensive health services for older persons, including preventive health checking and screening, chronic disease management, tender health. Don't forget about our teeth, okay, is not only the teeth is also the part of our body, okay. Rehabilitation services and addressing loneliness and mental health. Loneliness is a great challenges in the elderly group of people, okay. Apart from all this program strategy, that Ministry of Health also has noted the important to have a regulatory framework, okay, to ensure that the older people have a safe and quality of environment. So that's why a Private Age Healthcare Facility and Service Act 2018 was formulated and enacted to provide a more holistic regulatory environment for elderly care in Malaysia and ensure that all private healthcare centers and services are licensed and regulated. Okay, so in Malaysia's 12 Malaysia Plan 2021 to 2015, the older people's health is one of the prioritized focus area. Okay, they focus on improving the quality of care for older person, addressing their health issue, promoting a caring and capable society. Apart from that, Ministry of Health Malaysia also includes health aged care into several national health plan, national health strategy plan, as well as national oral strategy plan, which have shown in the slides. So T&CM is widely used globally to maintain the health and ensure well-being. So as the reported in the strategy, traditional medicines, regional strategy for traditional medicine in Western Pacific region 2011 to 2020 mentions that over 85% of the population in China and Korea were using T&CM, and above 50% in Malaysia, Brunei, Australia, Singapore, and Vietnam. They are all using T&CM. So T&CM encompasses a wide range of practices and recognized as a valuable addition to mainstream healthcare, especially for chronic diseases and mental health issues. So in Malaysia, more than 50% of the elderly populations believed that T&CM was superior to conventional medicine, and up to 83% of them regarded T&CM as beneficial for maintaining their overall health and well-being. Like for example, Tai Chi, Qigong also can minimize the risk of fall. For the people who more than 60 years old, age older group of people in Malaysia, you are categorized as older category of persons, means that after 60 years of age. So Tai Chi can minimize the risk of fall. Tai Chi, Qigong, as well as Indian medicine, yoga, meditations, all these help in our mental status to minimize anxiety and depressions. Okay. WHO's indicate that the use of T&CM is accepted by older populations and appears to play a role in achieving a good quality of life and in encouraging the participation of older people in healthcare decisions. WHO also recognized the potential of T&CM in promoting healthy aging and has called for greater integrations of T&CM into healthcare system. Please kindly refer to all these WHO's strategy as well as WHO's framework, so that to have better understanding of why WHO recognized the potential of T&CM or the role of T&CM in healthy aging. Can I move? Hold on, there's some technical error. My slide is not moving. Okay. Okay, thank you. Now, let us turn to the governance of T&CM in Malaysia. In Malaysia, T&CM governance is mainly categorized into practice and practitioner, educations and training, research and product. From the slide, you can see that for category of practice and practitioner, research and product, all are under the jurisdictions of Ministry of Health, Malaysia, except education and training. In Malaysia, education and training is under Ministry of Higher Education for academic level, whereas for the skill level, it is under Ministry of Human Resource. So, ladies and gentlemen, to promote safe, quality, and effectiveness of the T&CM service, Ministry of Health Malaysia has taken initiative to develop the national policy of T&CM regulatory framework as well as strategy to overlook the quality of T&CM services. The national policy of T&CM was formulated in the year 2001 and revised in the year 2007 with the main visions that T&CM shall be an important component of healthcare system. It will coexist with modern medicines and contribute towards enhancing the health and quality of life of all Malaysians. So this includes the elderly group of the populations. So T&CM Act 2016, or known to be Act 775, was enacted and implemented in phases. At this moment, it is in phase 2. Phase 2 is the registrations of the T&CM practitioner. That is to say, Malaysia has started to register T&CM practitioner. Those practitioner which is under this 7 recognized practice area has to register with the T&CM Council. For your information, at this moment, about 5,388 T&CM practitioners have registered with the T&CM Council. Okay, so from the calculation, we also aware that 0.124 of the T&CM practitioner per 1,000 population. Just now, from my second slide, I have shared with you that total populations in Malaysia is about 32.9 million. So at this moment, this amount of practitioner means indicate about 0.124 practitioner per 1,000 populations. And then the National Health Mobility Survey 2019 also pointed out that the first point of contact for the patients is to T&CM practitioner is about 0.9%. That is in the survey have mentioned 0.9% of the respondents admitted that the first point of contact is T&CM. Okay, so in our mainstream healthcare system. So now, ladies and gentlemen, the National Health Mobility Survey 2015 has shown that about 29.25% of the populations has used T&CM, okay, with consultation, and 21.51% of them has used T&CM within the last 12 months. Okay, the most common health issue which T&CM being used is to address the musculoskeletal problem. Okay, so as well as respiratory system GI problem. So this is the study has been reported in the National Health Mobility Survey. So for your information, in Malaysia, the Ministry of Health Hospital has provided T&CM services, but not all the Ministry of Health Hospital, about 15 Ministry of Health Hospital provide a limited T&CM services. The limited T&CM services are traditional massage for chronic pain and post-stroke, acupuncture for chronic pain, post-stroke, and chemotherapy-induced nausea and vomiting, herbal therapy as an adjunct treatment for cancer, Shirodara for insomnia, stress, mental fatigue, anxiety, mild depressions, headache, external plastic therapy for lumbar or cervical spondylosis, as well as osteoarthritis. Last but not the least, one-month therapy for cervical lumbar spondylosis and osteoarthritis of the knee and adhesive capsulitis. So, in fact, Shirodara, external plastic therapy, one-month therapy, they are traditional Indian medicines. This traditional massage is a Malay medicine, acupuncture and herbal therapy are Chinese medicines. Ladies and gentlemen, there is a report show that 40% of the public hospital T&CM patients are 60 years and above. So we provide service to 40% of the elderly group of the populations in the public hospital. There's consumer education guideline as well as several infography has been developed by traditional and complementary medicines divisions, Ministry of Health, to educate the public to have a proper use of T&CM services in Malaysia. Here, community health education's video have also been developed by the Ministry of Health to teach the public about the exercise, about healthy lifestyle, so that this includes also elderly group. In fact, Tai Chi, Qigong are good for the elderly group of the populations. The traditional and complementary medicines divisions has undertaken various various opportunity to promote the role of T&CM in healthy aging through local as well as international seminar and conference, as well as community outreach program. So back in 2019, T&CM divisions has organized an international conference of T&CM with the theme of integrated approach towards healthy aging. Then following that, a publication's titled Healthy Aging in Asia, Culture, Prevention and Wellness. It was published last year. Has been this publication is a collaboration with all the speakers from the conference. This publication aims to provide an insight into the culture, prevention and wellness aspects of healthy aging in ASEAN, with a particular emphasis on the role of T&CM practices. That's why T&CM does have a role in the healthy aging. Now, let us come to the challenges of how to integrate the T&CM into the mainstream healthcare system. And then in order to integrate the T&CM into mainstream healthcare system, we need to overcome the lot of challenges. What are the challenges? For example, diversity. Malaysia is a multi-ethnic, multicultural country. So T&CM is also has a diverse field that includes many different practices and modality. This imposes great challenges to formulating appropriate policy and regulation that suit all types of T&CM available in Malaysia. The second challenge is limited access. Within T&CM is widely practiced in Malaysia, it may not be easily accessible or available in all areas. Just now I have mentioned, like in Ministry of Health Hospital, only 15 of the hospital out of 146 Ministry of Health Hospital T&CM service is being offered. So there is a limitations also. So this can be especially challenging for elderly patients who may have limited mobility or transportation options. So they might not be able to reach the particular hospital which would offer the T&CM services. So low acceptance of T&CM, there is a lack of awareness and understanding of philosophy and knowledge between the T&CM and modern medicine's practitioner, contributing to the conflicts. And last but not the least, lack of scientific evidence. I think this is majority of us are aware about this. The vast field of T&CM is dynamic and ever-changing, while research gaps are huge, okay, especially for specific conditions or in elderly populations. So what Ministry of Health Malaysia has done, okay, to overcome all these challenges in order for T&CM to be incorporated into our mainstream healthcare system to participate in the aged care. So first, we need to strengthen the regulatory framework for T&CM. Fully enforcement of the Act. Just now I have mentioned T&CM Act already implemented, but in phases. So now we are in phase 2. Hopefully next year we will be completely enforced. So, and regulations to ensure a quality safety of T&CM services, to develop T&CM private healthcare facility services and Act. Okay, so that we also need to, like just now I have mentioned, aged care, the private facility which provide aged care, have a regulation, have an act to regulate them. So for T&CM, we also need to develop an act, okay, a legal framework to regulate the premises which provide T&CM services to the public. So second, develop practice guideline and standard. So to develop practice guideline and standard for T&CM practitioner to ensure the quality and safety of T&CM services to the nations. Third, encourage integrations with conventional medicines, encourage integrations of traditional and modern medicine to educations to increase knowledge and awareness between the practitioner. Fourth, strengthen the T&CM research, while guidelines to guide the researcher and encourage innovations. We need to plan a research on the safety and efficacy of T&CM interventions for the elderly with the National Institute of Health. So National Institute of Health under Ministry of Health Malaysia, okay, is a research institute. So last but not the least, enhance the public awareness and educations in order to develop material on healthy aging, while T&CM, and engage public with outreach and awareness campaigns in collaborations with relevant agencies. Ladies and gentlemen, my bring home message is everyone should age healthily with pride. No one should be left behind. Thank you very much for your kind attention.